Chekuri Suvarchala, Scientific Director with ZIVA Fertility Centers. Why are some months cancelled when you go to a fertility specialist for treatment? Well, there are a lot of reasons, but I would like to talk about one specific reason called presence of cysts in ovaries. What are these cysts and why do fertility specialists cancel your treatment during that cycle? So, what are ovaries? Ovaries are the organs where the eggs grow. There are two of them on the left and right of the uterus. They are connected to the uterus by fallopian tubes. The tubes pick up the egg which is released or ovulated by the ovary, and when the egg comes into the tube, the sperms, if they are present or when they reach the egg, they fertilize the egg, embryo is formed and it implants in the uterus. So that's the anatomy of a normal functioning reproductive system. When we talk about cysts, you need to understand that these are follicles that have grown definitely under the influence of hormones, FSH or estrogen and luteinizing hormone, but they have not ovulated. So the egg growing inside it has not ovulated, or the egg inside it was not present. So under the influence of these hormones, this cyst, this follicle keeps growing, fills up with fluid, but does not ovulate. And even after the period has arrived and gone, this cyst persists. Usually cysts are present all over the body. Anywhere it can be present, and depending on the size and the location and on the pressure it is applying on the organs close to it, the symptoms also manifest. But when we talk about ovarian cysts, they can just stay in the ovaries without causing any side effects. But when an ultrasound is done, when this cyst is revealed, then the size of the cyst or the size of the follicle gives us an idea that the cyst is causing infertility or is not letting your egg ovulate. So how do we solve this problem? Usually cysts in the ovaries disappear on their own. They may take a month or two, but if they still persist, then medications are given such as contraceptive pills. Under the influence of these pills, in a month or two, the cysts come down and normal ovulation can also come back into the machinery. Now, there are some moments when these cysts do not come down, and that is when cyst aspiration is performed. It's a very simple procedure where a needle is passed into the cyst or the overgrown follicle, and the water is aspirated, the fluid is aspirated. After the fluid is aspirated and the cyst comes down, normal ovulation, normal cycle may also persist. In such cases, it is easier for the patient to fall pregnant on their own or to respond to fertility medications and therefore have a better chance of success with treatment. If you want to understand more about cysts, if you have been diagnosed with someone having persistent cysts or cysts that are recurring every month, you want to understand how to increase your chance of pregnancy after a treatment of cysts, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.